You're burning from the inside out.
Call it menopause jowls.
Yeah, at first I thought it was like going through depression.
And you don't have any control over it. You just like snap.
Yeah, let's go sit outside. It's really nice out. My sex drive has gone downhill.
Losing your memory, walking into the room. What did I walk in here for? Crying at the drop of a dime, just walking down the street, and it's your hormones. That's what it is.
And I went to my doctors and said, you know, I think I need to go on antidepressants. And he's like, well, tell me what's going on. So I explained what's going on, and he goes, no, you're premenopausal.
It freaks me out once in a while if I'm walking on the street and I pass a window.
No.
Yes,
Is
it
that
does.
me?
And I go, oh my God, I've aged. You just dab very gently. My eyes became crepey.
Yeah, they go droopy. It's like we need plastic
Literally
surgery
overnight,
now.
I need an eye lift.
Now there's like this thing that comes down, and
Droops,
it's like, where's the
falls
eyeshadow
down.
going?
Crepey eyes.
Like the hot flashes were crazy. You're burning from the inside out, and instantly, like instant, like within like 2 seconds, you're like normal, and then you're just hot. Like I'd sleep with a towel under me, and I'd wake up and I'd have to go change the towel because it was soaking wet from the night sweats, and like tossing and turning. It's like tag team wrestling with yourself. It's terrible, and you got nothing on, like you're naked, and your sweat is just like
You're fully naked, and there's nothing you can do to cool down. And we want to talk about it all. We want to talk about menopause and keep it real. Like our two viewers, man, I love those two women because they really put out almost every aspect of what we hear from our viewers when it comes to menopause. But what's interesting, and this is what I just learned, Marilyn, you've gone through it, so we're going to talk about that. But from you, Marjorie, menopause is actually a very specific time. Yeah. We use it to describe a bunch of things, but really it's very specific.
Yeah, so menopause by definition is 12 years without a menstrual period. Then
12 years without?
Sorry, months. Sorry, not years. 12 months. I misspoke.
Oh my God.
Okay. Yeah, 12 months.
12 months.
12 months without a menstrual period. But the perimenopausal transition is usually about 4 years before that year with no period. So things start getting a little strange. And then it can be as long as 10 years before. So some women, the average age of menopause is 51. Mm-hmm. So some women at age 42, 43 are starting to notice changes. So the first thing you notice is not that your period stops, but your period kind of gets shorter. So first it gets shorter, and then maybe it skips a month, and then it gets way heavy. And then it's unpredictable. So people get very, I know that this is probably normal, but I don't really know what to do with it. And it's hard to deal with it because then there's heavy bleeding and no bleeding. Yes. And when are you bleeding, you don't know. So it's not like before where it's predictable every 28 days-ish for most women. Mm-hmm. And then also, then there are these symptoms. So we talked a little bit last time about kegling and tightening the muscles. Yes. But it's not just the muscles, because estrogen that you have, what happens before menopause is your menstrual cycle, right? Yeah. So that's your brain sends a message to your ovaries pick up the phone and start making estrogen, and it goes to all of your tissues, and then it feeds back, and then whoop, you ovulate. And then that period where your estrogen is high right before you've ovulated is your happy randy period. Yes. So your partner's like, this is the best time of the month. Yes. That's because your estrogen is high. So your sex drive is more, your vagina mucus is coming freely, and you want to be sexually involved. See, Marilyn's getting it all, yeah. And then what happens at menopause, when you stop doing all that, your brain screams at your ovaries aren't picking up the phone, there's no estrogen making.
Pick up the phone!
Oh, yeah. Yeah.
No. It's called end organ failure. So your ovaries are not making the estrogen that they used to do, that nice happy cycle. Right. And you don't do it anymore. And when you take, it's like taking candy from a baby, your whole body goes, what? Right? So all of the tissues, your central nervous system, the hot flashing, that's because your thermoregulatory zone, or the way that you control your temperature, it's off because they took the estrogen away.
Okay, so estrogen is the key here. When you've got it running through your system, you have a happy vagina, you have
good memory,
temperature regulation, you have a good memory,
great skin.
You've got great skin.
I know.
And then the estrogen goes away and your vagina gets mad.
Angry and dry.
Very angry.
Dry.
And your sex drive goes down. Okay, so let's talk about this a little bit. Dry. So dry.
And there's a word for it. It's genitourinary syndrome.
Shockingly dry.
Yeah, you could use a whole lube thing and slide off the bed and it wouldn't help.
That dry.
That dry. No, because it's like, we don't care. Like,
right.
Yeah, but then I discovered the magic pill that makes your vagina fluffy.
Okay.
And it changed my life.
I want to know what the magic pill is, but before we get to the fluffy vagina, I want to talk about when the estrogen is gone and everything is dry, sex must become painful.
Yes.
So you have a combination of a lower libido, and then you have painful sex, and so then that's why there's a dropping off.
Yes, and there's actually a name for it. So they decided.
Hell.
Well,
It's called hell.
It's that syndrome of the vagina and the urinary system. So it's genitourinary syndrome of menopause.
Okay.
Because estrogen goes away, and some women develop really irritation in the vagina, dryness that they feel even when they're not having sex, just walking around feeling dry.
Ew.
And then urgency to pee. Yeah, I know. It can be
that's
worse.
really
And urgency to pee. So it's important for women to understand that this is a normal part of it, and it's not in your head, because sometimes they go, like as that woman who said, and her doctor says, oh, yeah, it's just menopause. Well, yes, but not everybody's experience is the same.
Yeah.
And there are things that you can do, understanding that it's coming and knowing that you can change it with fixing it makes people feel empowered and not so alone and maybe depressed, right?
Yeah, well, we need to talk about it, because if you think that something's, you see that you're irritable and you don't have a reason for it, you see that you have a lower sex drive, you see like things are falling off and no one's talking about it, it's a problem.
Yeah.
It's better that we talk about it and jumping into it so that we know what to expect.
Right.
And you're not crazy and all those terms they use to describe women that are going through hormonal changes.
Yeah.
This is a natural part of life.
Well, there's a good physiologic explanation for every single symptom and manifestation of menopause.
Yes.
Understanding it and knowing what you can do to work yourself through it empowers women. And then you're like, oh, so this is what it is.
Okay, so tell me about the happy pill now. How does this work?
Well, you tell.
Okay, I'll tell, and then she'll be the experience of the happy.
Okay.
Yes.
So it's when you it's clinical person. So when you actually add back estrogen. So in the older days, it's bad to say that, but like 15 years ago, they used to talk about estrogen replacement, and it should be in the water for everyone so that women stay happy postmenopausally. Then we realized that there are some effects of being on hormones indefinitely orally, because it first passes through your liver and it affects you systemically. So then they figured out that we could actually deliver estrogen just locally in teeny tiny little doses into the vagina. So it can be a pill, it can be a ring, it can be some cream, but it's estrogen therapy for the vagina locally.
Okay.
And then it helps. So what happens to the vagina when estrogen goes away? It gets thin. There's usually kind of a root, we call them rugae, like kind of rolls in the vagina. That all changes, so it gets thin. The hair goes away also on the vaginal labia also. The small, so you have two vaginal lips, the labia majora and the labia minora, the little ones. They fuse. So everything changes, but you add back estrogen and magically things get a little bit more moist.
Are you saying you get an instant bikini wax though? The hair all goes away?
No.
No, that's not a good.
It doesn't all go away, but it becomes much more sparse.
Oh, okay.
Yeah.
All right. And that's not a good thing?
Well, that's a good thing for lots of people, I guess.
Right.
Yeah.
Okay. All right. So is it a suppository then?
It's a vaginal suppository.
Yeah, right.
So, and actually, you see the experience of patients when they come in and they're like unhappy and feeling fleshy and hating everybody around them because people don't understand them, and they get really, really hot and nobody understands. They need to undress. You say, well, this is normal, and then what I can do for your sexual health is this, and go and try it and start. And actually, they come back like,